If you are a diabetic, stop doing these four things now. Assalamualaikum guys, welcome back to my channel with one more episode of Healthcast with Dr. Adib. So आज का टॉपिक है कि भाई stop doing these four mistakes if you're diabetes. So let's start the video. The first mistake is the minute you're diagnosed with diabetes or you are an old diabetic patient. So the biggest mistake every diabetic does is कि eating less means you can cut down sugars. सो ये बहुत बड़ा मिसकंसेप्शन है कि भाई इफ़ यू आर ईटिंग लेस तो जो है आप जो है यू विल रिड्यूस द शुगर्स वेरी फास्ट, आपका शुगर लेवल बहुत जल्दी नीचे उतर जाएगा. दिस इज वन ऑफ द बिगेस्ट मिस्टेक. द फर्स्ट प्रॉब्लम विद ईटिंग लेस इज कि इफ़ यू आर गुड इन टेकिंग द मेडिसिन एंड इफ यू आर टेकिंग योर मेडिसिन वेरी प्रॉम्प्टली, और अगर आप नहीं खा रहे हैं, यू थिंक कि भाई मैं खाना कम कर दूंगा और साथ में मेडिसिन लूंगा, मैं शुगर विल बी well under control, it will get controlled in a day or two, और उसके बाद जो है मैं दवाई स्टॉप कर दूंगा. So this is the biggest misconception. What happens if you eat less? Suppose कि भाई you think कि भाई I will not have my breakfast, I will only have my lunch. Okay, the next day you think कि भाई I will not have my lunch, I'll have only breakfast and dinner. What happens is कि when you have a long gap of fasting, और जो है अगर आप बहुत लंबे समय तक भूखे हैं, तो in between what happens is कि one is you have the urge of eating more, the craving increases. So you are empty stomach for a long time, then you tend to eat more. When you eat more, there is surge of sugar, यानी कि there is a spike of sugar. तो जितना इंसुलिन बॉडी में बनता है और जो मेडिसिन हम लोग देते हैं, that is not sufficient to cut down the sugars and you will always have spikes of sugar. So the best thing is eat regularly, eat small portions of meal, concentrate more on protein and fiber. So the best formula for the food is dal, sabzi and roti. And if you are a rice lover, some small quantity of rice is also acceptable compared to not eating. So always have a healthy habit of eating. Eat at a correct time, eat at a regular time and eat at a regular interval. Only thing is the portion of the size should be small so that the number of divided portions of your food are divided into number of times. If you are eating for 3 times, you can make it for 5 times so that the absorption of sugar increases and जो है इंसुलिन जो है मल्टीपल टाइम्स प्रोड्यूस होता रहेगा and the medicines which you eat both together act on the food and you don't have the spike of sugar. The second important mistake is depending only on medicines and insulin. The minute you go to the doctor, you're diagnosed with diabetes and the doctor gives you medicine और आप समझोगे कि sugar गायब. It is not like that. So you have to have two things in your mind. One is medicine is 50%, the remaining 50% is in your hand. In your hand मतलब कि भाई the lifestyle matters a lot in diabetes. अगर 50% दवाई काम कर रही है तो 50% जो है आपकी lifestyle contribute करती है in the control of sugar. So what is the lifestyle contribution? The lifestyle contribution is proper exercise, proper food, avoiding unnecessary carbs, avoiding unnecessary sugars. अब unnecessary sugar, most of the patient says I don't eat this, I don't eat that, but in spite of that my sugar is high. The unnecessary sugars come from your tea. You take 2 times tea and you are adding sugar. The whole tea is sugar. The second thing is the coffee what you take, the juices what you take, the sweets. You think about sugar-free products which are marketed in the market are all have some amount of sugar. Only thing is कि भाई the variety of sugar may be different but they have sugar. So जो है always read the label properly, क्योंकि बहुत टाइम जो है they say कि भाई sugar is not there but different varieties of sugar रहता है. So always remember कि भाई to check the label before eating or drinking. So only depending on medicine is also a biggest mistake. So eat properly, eat healthy food, have a healthy lifestyle in the form of exercise, avoid stress and have a proper sleep of at least 6 to 7 hours. And these things help you in maintaining your sugars along with the medicine. So the mistake, how to overcome this mistake? So medicine 50% and lifestyle 50% helps to control your sugar 100%. The third important mistake is once you detected diabetes, you have started medicine, you have started your lifestyle changes, everything, and you are living easily. That is the third biggest mistake. You have to have regular checks. Okay, you cannot come to the clinic, you cannot come to the hospital, you cannot go to the lab, no problem. Buy a normal glucometer at home and you can check your sugars. Just remember the thumb rule. of fasting, sugar should always be less than 100, and 2.5 hours after the food, the sugars must always be less than 200. Always have a check of your sugars at home. Never ever think about your sugars might be always normal. There are a lot of factors that spike the sugar in spite of having a healthy lifestyle, a normal food, that we will discuss in the other videos के भाई जिसमें मैं आपको बताऊंगा कि what are the other factors that increase your sugar apart from food and lifestyle. So that we'll discuss in other video. The fourth important mistake is ignoring complications. How do you know that you are having complications when you are a diabetic? See, body itself is like a machine. Whenever there is some problem in the machine always gives you signal. The same way body also gives you signal when you have complications. What are the simple complications that you can find out? One is you are having blurring of vision, or any change in the normal vision is one alarming thing. Second thing is you are having wound and it is not healing fast. You are having repeated infections. You are taking courses of antibiotics, but in spite of that you are having repeated infection. Fourth thing is you are passing too much of urine, which might have been the first symptom when you were diagnosed with diabetes, but in spite of taking medicines you are getting a number of times in the night to pass urination. These alarming signs should make you understand that this is the time you need to consult your physician. So whenever you are having these type of symptoms, you need to consult your physician as soon as possible. So these are the four common mistakes. We always ignore the complications thinking it will get corrected. I have done this, so I will correct this. I have been eating a lot of sugars in the past week, so I'll cut down the sugars and it will get corrected on its own. So avoid doing these four mistakes. If anything in these is not happening, consult your physician. Try to change your medicines. Try to bring in lifestyle modifications so that your sugars get well under control. One bonus tip I'm going to give you today is the best way to control your sugars or to have a controlled sugar is to exercise at least 30 minutes a day for 5 days a week. 2 days you can give off. So this will help to reduce your sugar by at least 5 to 7%. Send this video to at least one of your friends who has diabetes so that it helps to improve their diabetes and avoid these mistakes. So if you like this video, एक लाइक शेयर सब्सक्राइब जरूर बनता है. मिलेंगे अगले वीडियो में. तब तक के लिए stay safe and healthy and avoid these four mistakes.